arise to ask questions 47/2017 under my name, and the question is forwarded to the Minister for Health and Medical Services. The question reads, can the Minister inform this House on what were the actions of the Ministry in regards to Qamea Health Facility that was destroyed by the landslide during Tropical Depression 04F? Thank you, Madam Speaker.
Thank you. Honourable Minister for Health and Medical Services.
Thank you, Madam Speaker, and I thank Honourable Kumar for the question. Madam Speaker, Tropical Depression TDO4F brought about heavy rain that caused a severe landslide on Qamea Island. Unfortunately, our health facilities at Reketi village, the Qamea Health Centre and 3 staff quarters were totally destroyed, along with the school and about 20 houses. The Ministry of Health and Medical Services, Madam Speaker, acted very promptly by taking immediate actions after the landslide. The staff from the health centre was evacuated to Taviuni Hospital. A health team was immediately deployed to Qamea Island. A temporary health centre manned by a nurse was set up at Vandavandra settlement. Additional health supplies and drugs were dispatched from Suva to Qamea. Patients who required further treatment were referred to either Taviuni and Lambasa Hospital. The health team also conducted an intensive 2-week health outreach program after the landslide, which included assessments of the following communities: Reketi, Udinivatu, Dokoma, Tongo, Waimbulu, Batu Songo, Nandilo, Yanuda, and Naivivi. Madam Speaker, the government's multi-sectoral approach to respond with urgency to the needs of those on Qamea had brought relief in terms of addressing the most immediate needs and plight. A second medical team was deployed as part of a multi-agency working group under the guidance of the National Disaster Management Office. Their role was to conduct detailed damage assessment, carry out relief assistance, conduct debris clearance, and provide sanitation and hygiene services to the affected population. Madam Speaker, looking beyond the immediate response, the Ministry is also considering how best to meet the future health needs of the people of Qamea. Following the loss of the Qamea Health Centre, we are now considering what should replace it, and a geotech team from the Department of Mineral Resources has already completed a survey of potential sites for a new Qamea Health Centre. The details of the survey findings will be presented to the Honourable Minister for Rural and Maritime Development and National Disaster Management. A decision on the site will then be made in consultation with technical teams for the design and construction timeline, subject to Cabinet approval. Madam Speaker, apart from the services provided by Temporary Health Centre at Vandavandra, a medical officer, a public health nurse, a dietitian have also been dispatched to complete a comprehensive health outreach on Qamea. The team has completed its task and returned to Taviuni. We also had a health inspector along with a peer educator and a labourer from Qamea conduct environmental health, water and sanitation awareness. The team also further conducted disinfectant and anti-mosquito spraying in communities. Wash kits, water sanitation, hygiene kits were also distributed as part of this intensive outreach. Madam Speaker, apart from emergency healthcare services, the Ministry was also successful in addressing psychological concerns of people affected by the landslide. Empower Pacific teams of counsellors were deployed to Qamea to provide first aid and crisis intervention support in the identified affected communities. The clinic nurse will continue to provide the medical service based from Vandavandra settlement in Qamea. Taviuni Hospital will also continue to provide assistance and support for the health needs of our people residing in Qamea. Thank you, Madam Speaker.
Thank you.
Thank you, Madam Speaker. My question is, does the Ministry make assessments of other health centres to make sure that what happened at Reketi will not happen anywhere else, given the frequency of tropical depression, especially this time of year? Thank you, Madam Speaker.
Honourable Minister.
Madam Speaker, thank you very much. I am not clear as to what kind of assessment the Honourable Member is talking about, but I can inform the House that my Assistant Minister has been travelling around maritime areas health centres, and after Parliament we will sit together for a report that will be worked with the management team at the health quarters, and will progress with what the report indicates. Thank you.
Honourable Naikula.
New complex at this new site, when can the people of Qamea expect it to be completed and fully staffed?
Madam Speaker, I'd like to say soon, but as I've mentioned, I mean, that the assessment report has been completed, and we have the report will be presented to the the National Disaster Management Office and to the Minister for Rural and Maritime Development, and we wish to speed up the process so that we can provide those services to the people of Qamea.
Thank
Sorry,
you.
no.